Today, NSF International is known as a global leader in public health standards, independent testing, and product certification. But 75 years ago, NSF was just an ambitious idea. At that time, national public health standards didn't really exist. Sanitation practices varied from state to state and county to county. A young man named Walter F. Snyder saw this firsthand while working in a neighborhood grocery store in Toledo, Ohio. He was among the first to see a need for more consistent sanitation practices. Eventually, Walter attended the University of Michigan's newly formed School of Public Health, where he met Dean Henry Vaughn and Professor Nathan Sinai. Together, they founded the National Sanitation Foundation in 1944. Their vision? A nonprofit organization devoted to scientific research and collaboration on important public health issues. Within just a few years, they brought together more than 300 experts from across the United States at the first National Sanitation Clinic. The year was 1948, and Americans were dining out like never before. To prevent foodborne illness, NSF went to work developing hygiene and sanitation standards for commercial food service equipment. They gathered experts from academia, government, and industry. It was a model of collaboration and consensus building that NSF still embraces today. In 1952, their efforts resulted in the first NSF standard for soda fountains and luncheonette equipment. Soon after, they focused on requirements for commercial dishwashers and other food equipment. The benefits were clear, and health departments across the country began requesting NSF's help in other areas, like public swimming pools, plastic pipes, and drinking water. Work continued through the 1960s and 70s. After passage of the Safe Drinking Water Act, the U.S. EPA commissioned NSF 60 and 61, which are now considered the gold standards for drinking water products. Over the years, NSF expanded into new areas and product categories: drinking water filters, dietary supplements, organic certification, health sciences, and sustainability programs. Today, NSF has more than 100 national standards and dozens of other protocols. The organization operates laboratories and offices around the world, testing and certifying products, conducting food safety audits, training, and consulting on public health issues. The world has changed immensely since 1944, and it will continue to change in the coming decades. New public health challenges will emerge. Collaborative solutions will be required. And just like in Walter Snyder's day, NSF will be there, bringing people together to discuss public health and safety issues and develop voluntary consensus standards. By working together, we can protect the food we eat, the water we drink, the air we breathe, the healthcare products we use, and the environment we all share.